Namaskar, my name is Vivek Sharma and you are watching me for the last 2 days, and we had been interacting with the oncologist over here at 6th masterclass in lung cancer, and we had been learning a lot of things about the sessions that are going on, and we had been learning new things from the oncologist. And with me is Dr. Kripa Bajaj, who has come from Hyderabad, and Dr. Saab has been having a session over here. And before we get into the conversation, let me understand, or let me share one perspective with you. Like, it's monsoon in Mumbai, and there is one thing that drives us crazy, that is the traffic and the monsoon, of course. And the drivers also, they get crazy, and there is something called driver mutations in oncology, and that is also quite a significant thing. Dr. Saab, namaskar, and a very warm welcome to you.
Namaste and thank you.
uh, please share with us, like, what was your session about, what is this one, what drives cancer crazy, and how do you deal with it?
Just like you mentioned, very true, you mentioned the mutation drives the cancer crazy. So just like I mentioned before, one family is headed and driven by one person, one force in the family. Just like lung cancer also will be driven by one force. So that is gene mutation. The happening field in lung oncology is the driver mutation analysis. If ever we find it's positive, we try to target with certain tablets. So these are called as targeted therapy. My session was on NTRK fusion mutation protein and its management. So it's a rare cancer, though in the some cancers it is a very common, but lung cancer, it is less than 5% of the lung cancer will have NTRK mutation, the fusion mutation positivity. If ever it is positive, so if we don't find a common mutation, we try to analyze for the NTRK. If ever it is a positive, we try to offer them a certain tablet therapy called as larotrectinib and entrectinib. With that, so people do say stage 4 cancer, like they'll not survive for few days, or they will survive only for few days and few months. Yeah. But even though it's a rare one, if I find it, if I offer that tablet, that's larotrectinib and entrectinib, people do well for 3 years, 4 years, 5 years. So it's very important when we don't find a common mutation to analyze for uncommon mutation. If it is positive, better we target that, so that patient will have a better benefit and survival.
Oh, that's amazing. I mean, apart from this NTRK mutation, what all things have been discussed in this session?
So lung cancer is a very happening field. It's a very evolving field. Like if you see the past 2 years, any field in oncology has developed like very fast, rampant. That's a lung oncology. So we discussed regarding various target therapies. Almost 60% of the lung cancer will have a target mutation positive. If it is positive, we can help the patient by offering the target therapy. They'll have a survival of many more years. It's not just like few days or few months, they'll have many more years. I have patients who did really well and still doing well, almost 8 years, 9 years, doing all jobs actually, household work, everything without any hindrance. So the advantage is target therapy is not just the survival, they will do survive very well for many more years, but also quality of life. We do see people, having a social stigma because of chemotherapy, they'll wear hats and they'll not mingle with people, all these things. But if patients is kept on target therapy, they'll not have any side effects. They'll look absolutely normal, they feel absolutely normal, they can do all activities just like normal person. And also one more session what we discussed, and it's a very happening field in whole oncology, is the immunotherapy. Immunotherapy, if we find some percentages positivity, we can offer the patient immunotherapy. The benefit of immunotherapy is there at every level of lung cancer, be it a early cancer, be it a stage 4 cancer. The benefit of immunotherapy is magnificent, I would say. So if we offer, which patients we can offer, what kind of benefit we do get by offering that expensive therapy to the patients, we discussed. And also we have various patient support programs for all kinds of therapy in the lung cancer, because patients, the motto of pharma company is not just making money, and also we endorse pharma companies to help the patient and support the patient in a way they get maximum benefit out of it.
Amazing. Thank you so much, Dr. Saab, for the update. And you're watching Dr. Kripa Bajaj from Hyderabad with me, Vivek Sharma, social entrepreneur. Stay tuned, don't go anywhere, we'll be back.